Hey everyone, and welcome back to my channel. So today we're going to be discussing Pheochromocytoma. You've probably heard about this in your classes, but it is a disorder of the adrenal gland. As you know, we are going through the adrenal gland trying to hit all the important topics that you will encounter in nursing school. Now, we've talked about this in other videos. The adrenal gland is found on top of the kidneys. And one part of the adrenal gland is the adrenal medulla, and it produces catecholamines such as epinephrine and norepinephrine, which you've probably heard about because they prepare the body for fight or flight response. Now, I want you to think back to pathophysiology. When our bodies perceive a danger or a threat, the immediate response is to prepare you to either fight or confront that danger or flee and run away from that danger. That's why it's called fight or flight. Now, in order to do this, your body will prepare itself physically by dilating your pupils so that you can have better vision during that very crucial time, opening your lungs for easier breathing. It might increase your blood pressure and your heart rate, and it slows digestion so that it can conserve energy so you can have enough energy to either fight or flee whatever is going on at that time. So now we've talked about what epinephrine and norepinephrine do in the body. They help with that fight or flight response. So remember those physical changes that happen during the fight or flight response. Now, in the condition pheochromocytoma, there's a benign tumor that is on that adrenal medulla, and so it's causing too much secretion of epinephrine and norepinephrine. So think about all those things that epinephrine, norepinephrine cause in the body, but increased in almost a double amount. Why? Because there is hypersecretion of both hormones. So like we talked about, the causes here are hyperplasia of the adrenal cortex or a tumor on that adrenal medulla. So big signs and symptoms for you to remember. If you can remember the 5 H's and that everything is high. So hypertension, we talked about hypertension as a fight or flight response. Headaches are also associated with hypertension. Hyperhidrosis, which means excessive sweating. Hypermetabolism, and then hypoglycemia. And hypermetabolism pretty much is happening here because of too much epinephrine and norepinephrine. The body is feeling like it needs to go. And so because of that, there is a hypermetabolic state that the body is currently going through. As far as diagnosis goes, this makes sense. One of the ways to diagnose is by checking the plasma levels of that epinephrine and norepinephrine hormones. A 24-hour urine collection of both epinephrine and norepinephrine also aids the diagnosis. They may do a CT scan, an MRI, a PET scan, and they may be looking for any tumor that's on that adrenal medulla like we talked about. An adrenal biopsy pretty much entails going in there and taking a little piece of that adrenal gland to kind of test it and see if anything is found. And there's something called a clonidine suppression test. So pretty much if pheochromocytoma is present, the epinephrine and norepinephrine is not usually suppressed when clonidine is given. And that also aids the diagnosis as well. So as a nurse, what is your job? We already talked about the signs and symptoms. We said hypertension, hypermetabolism, hyperhidrosis. So your job is to monitor the vital signs because everything is high. If the patient is hypertensive, they could also be tachycardic. So they might have high blood pressure and also have a high heart rate as well. So your job is to monitor the vital signs because you don't want it to get to an alarming stage where you don't let the doctor know so that the patient can get medications to help bring those down before we get into a red zone. Now, you're going to give this patient high-calorie and nutritious foods, right? Because if they're having hypermetabolism, their body is go, and processing the foods in there very quickly. They're losing all the nutrients just as quick as they're eating it. So you want to give them high-calorie and nutritious foods so that they're still getting those vitamins and minerals that they need. Of course, tell them to avoid caffeine because it can contribute to that tachycardia And then you want this patient to have frequent rest periods because they have too much going on. And with frequent rest periods comes a quiet environment as well. A big one, do not palpate that costovertebral angle. You probably heard about that before. That's angle right there at the costovertebral area where we used to check for any kidney tenderness. Now we know that the adrenal medulla is located on the kidney, so we don't want anybody palpating that area because it can cause that tumor to rupture. So stay away from palpating the costovertebral angle. And also the treatment for pheochromocytoma may involve just removing that tumor surgically. So big thing I want you to keep in mind here is that you may end up giving medications like alpha blockers, beta blockers prior to that surgery. Other medications like nitroprusside and calcium channel blockers like nifedipine may also be used. So if the doctor orders for the patient to receive those, then you have an idea why the doctor has done that. All right, that's the end of this topic. Remember that the topics here are very, very simplified because I want you to get the biggest and most important points out of each topic. So I hope these PowerPoint slides help you to understand the topic a little bit better. If you have other topics you want to see, then leave me a comment below so that I can know to cover them. But until next time, make sure that you subscribe to my channel and that you have the notification button on so you can be notified whenever a new video is available. Thank you for sticking through this topic with me. Look out for the next one. Have a wonderful day. Bye-bye.